excuse me. I guess it's good afternoon for some of you, depending on where you are. Welcome. And apologies, I had the wrong controller thing here. I'll be your presenter today. My name is Brian Haley. I'm a registered clinical counselor on the Sunshine Coast in BC. Thank you for joining us today. So I just wanted to say in the beginning here too that I will be taking questions at the end of the webinar today. So I'm going to leave about 5 or 10 minutes at the end, and for those of you that would like to ask a question, please feel free to do so, and just go to the question feature on the controls, on the control panel, and type in your question, and I'll do my best to answer the questions for you. If I'm unable to answer your question, I will get back to you with an answer at some point. So, welcome again to the webinar series. Today we're going to be talking about HeartMath, or the HeartMath Solution, primarily for relieving stress and anxiety, although HeartMath has numerous other benefits as well, and we'll be touching on those too as we go through this presentation. But stress and anxiety are the two things that the two issues that HeartMath was originally kind of designed for, and then as they went through the past couple decades of research and so on, and of course accessing other research done by independent scientists and researchers, they've discovered all kinds of other benefits as well to this method. And HeartMath involves a kind of a combination of techniques and also technology that we can all use as lay people to help us in terms of relieving stress and anxiety, and also gaining the other benefits that we'll touch on as we go through this. So, and I will, near the end, I will be teaching a technique, a simple technique that we can all use for the relief of stress and anxiety, and it's something that we can use and get results right away, really. And I use this with almost all of my clients. So, and it takes only about 5 minutes, and I think you'll enjoy it as we go through that. So the benefits of HeartMath, learning outcomes for today. First of all, we're going to do a little overview of stress and anxiety, how that impacts us, and so on. We're going to be doing an introduction, of course, to HeartMath. We'll be looking at some of the science that backs up the HeartMath claims and supports the HeartMath solution. We'll be looking, of course, at about how it works and how it can work for us specifically. And of course, as in the introduction, I mentioned that we'll be looking specifically at how we can, decrease our stress and anxiety. And this is an important topic, I think, for most of us these days. So this first quote here by Dr. Paul Roche, who is also the president of the American Institute of Stress. Although stress is difficult to define, all of our clinical and experimental research confirms that the perception of having no control is what stress is all about. So it's that issue of control, or the feeling of being overwhelmed and losing control of our emotional world, our psychological world, and so on. And this is what the outcome or the result of all the stressors in our life is. Anxiety is frequently linked to the perception that things, like, for instance, the environment, other people, be our family, our co-workers, and so on, my feelings, my thoughts are not in my control. And this quote is from Doc Childra and Deborah Roseman, who wrote an excellent book, and I'll give the information on that at the end. Actually, 2 books. One is called Transforming Stress, and the other one is Transforming Anxiety. They came to the same conclusion, that it's about that control issue. And we'll elaborate on this concept as we go through the presentation. So in terms of studies, there's been lots of studies done, and I'll touch on these as we go through here. But there was a Harvard study that showed that people who live in a state of high anxiety are 4.5 times more likely to suffer sudden cardiac death than non-anxious individuals. Now, I don't do this as a scare tactic. It's just to show how serious this matter is. That often we think of stress and anxiety, and we think, well, you know, everybody experiences stress, which is true, and often that results in anxiety. But what we're talking about here is when we have that issue or that concept of no control or that feeling of losing control in our lives. That's when we're starting to get into some dangerous territory. And even for some folks moving into kind of anxiety disorders, which certainly has a negative impact on not only our emotional world and our psychological world, but also on our physical health. Another study, and in fact an international study, revealed that people who are unable to effectively manage their stress have a 40% higher death rate than their non-stress counterparts. So these are two independent studies, again, just pointing out the seriousness of stress and anxiety on all aspects of our lives, and hopefully with the result that you know, we look at this in a serious way. So our myriad metabolic and physiologic fight or flight response to stress, these happen automatically and instantaneously. We don't even really, before our thinking brain actually even kicks in, our automatic brain, or the amygdala it's called, kicks in automatically, and we find ourselves in that fight or flight kind of response to stress. And this fact that this physiological kind of response happens automatically and instantaneously is a key point to remember here, because as we go through looking at the features of HeartMath and so on, we'll see how we can, with the HeartMath solution, how we can interject there, how we can break that automatic and instantaneous kind of response that's happening. So that's a big part of the power of HeartMath, actually. But there is a solution to this. There's a solution to the stress and the anxiety that we're experiencing. And a big part of that solution is shifting to positive attitudes and feelings, produces PET scans or CAT scans, whatever, of the brain that are almost identical to the scans generated by real mood-altering medicine. So we're getting the same kinds of results in these scans, these PET scans and so on of the brain, that are showing the effects of focusing on positive attitudes and feelings to the same level, really, as mood-altering drugs. So this was an important finding, really, and again, sort of a confirmation of the HeartMath solution. Here's an interesting quote, again from Dr. Roche, that the ancients believed that the heart, rather than the brain, was the seat of emotion. Whereas current research, and in fact up until probably the last decade, maybe two, scientists, psychological researchers and so on, all felt, or the sort of accepted idea or concept was that both our thoughts and our emotions are coming from the brain. Of course, as we can see here, the ancients believed that the brain, or the heart, sorry, had its own brain, the heart and mind, they called it. So HeartMath research has demonstrated that the magnetic field of the heart is much more powerful than the brain. And that in and of itself doesn't say a whole lot, but it's a key sort of feature here and a concept that I'd like you to keep in mind as we go through this, because what they found actually is that the electromagnetic field, the EMF field of the heart, is actually 100 times or more powerful than the EMF field that the brain puts out. So that's a significant finding in the research, and again points to the power of the heart. The HeartMath tools improve one's awareness of the relationship between thoughts, feelings, and our body, rather than working on the anxiety itself. So many techniques out there, which some of them are actually quite effective on dealing with anxiety and stress. Focus in on the anxiety itself directly, whereas HeartMath comes at it from looking at the source, really. What's going on here? What's what's causing this anxiety and what's feeding the anxiety, even more importantly. So the HeartMath tools are allowing us to really see that relationship between the thoughts, the feelings, and the physiological responses that happen as a result of stress. And many, if not all of us, know or are familiar with some of those results and outcomes of feeling stressed and feeling anxiety. So, ways to deal with stress and anxiety. What I'd like to do before we get into a bit more of excuse me, a bit more of a discussion about HeartMath itself, the HeartMath Solution, is I wanted to just give you a quick sort of a run through on some other ways that we can deal with stress and anxiety, because there are other ways, and in fact, these things can be supportive of HeartMath, and HeartMath can be supportive of these points as well. So first of all is what we call the relaxation response. And as we might suspect, it's a way to bring us into a relaxed kind of state. And as we might guess, this is kind of the opposite of stress and anxiety. So the relaxation response includes things like deep abdominal breathing, focusing on a soothing word such as peace or calm or ease. It includes things like visualization of a tranquil scene. For instance, if if you had been on a holiday to a tropical kind of place, and you're imagining, you just bring back into your mind's eye the scene of sitting there and on the beach and looking at the waves and the turquoise water and so on, or even just an experience in being out in the forest and in nature, and visualizing that time. Now, that doesn't work for everybody, but for some people it is quite helpful. And also things like yoga, tai chi, meditation, of course, and for some folks, repetitive prayer, that works for you. And countless studies really have been conducted on the effectiveness of meditation in relieving anxiety and stress over probably the last, I would say, 4 decades. So there's lots of research that points to the power of that. Physical activity, and this is one that a lot of us might just know sort of intuitively, that as we exercise, what we're doing is we're kind of stifling that buildup of stress in several ways, really. Exercise, like even just taking a brisk walk after we've shortly after we've been feeling stressed. And what this does is it not only deepens our breathing, of course, but it also helps by relieving muscle tension. We're getting those muscles working, and anxiety and stress, as we know, go into the muscles, and we tighten up and so on. So, and also the movement therapies that I mentioned earlier, like yoga and tai chi and qigong and all these kinds of things. What they do is they combine fluid movements with deep breathing, which is also very important, and mental focus. And all of these things, and especially all of them together, can really help to induce a kind of a calm state. So some specific examples here of how exercise helps us and how physical activity helps us is that it releases neurotransmitters in the brain, and these neurotransmitters have an uplifting effect on our mood. Exercise also tires the muscles, and by tiring the muscles, we're preventing some of the anxiety symptoms from coming up. And of course, exercise also actually burns stress hormones like cortisol and so on that trigger anxiety and sort of get us into a cycle of anxiety. Next point is social support. This would be our confidants and our friends and acquaintances, co-workers, relatives, spouses, all sorts of companions in our life. And they all provide a life-enhancing social net. And in fact, it can even increase longevity, some of the studies show. It's not clear why, but the theory holds that people who enjoy close relationships with family and friends and receive emotional support as a result of that, they indirectly helps to sustain them at times of stress and crisis. And I would add to that love and affection. This may sound silly, but things like hugging. Hugging is really good medicine. It lowers cortisol levels, which is the stress hormone, and increases oxytocin, which is the love hormone. And believe it or not, this has been proven scientifically. So giving and receiving as many hugs in a day, especially when you're feeling stressed, and from your spouse, family, friends, that sort of thing, can be extremely beneficial. Even spending time hanging out with your pet, you know, your cat or your dog or whatever. So love and affection really should not be underestimated in terms of stress relief. Diet and supplements. Sometimes our diet can actually aggravate stress or anxiety levels. So what I would suggest to you is, because I'm not a naturopath or nutritionist, is to do some research online for yourself, if you wish to. Find out what foods might contribute to stress and anxiety, and what foods might reduce it. And certain supplements can also be helpful there. So best to speak to a nutritionist or a naturopath in regard to these things, but that can be very helpful as well. And lastly, but not least, is acceptance. And what do I mean by that? Well, accepting that we're anxious and remembering that anxiety, after all, is just a feeling like any other feeling. And by reminding ourselves that anxiety is simply an emotional reaction, we can begin to accept it. So seeing that and realizing it, and then leads to that acceptance. And acceptance is really critical, because trying to wrangle or eliminate anxiety often worsens it. And I think any of us that have experienced that, we know that. But trying to fight against it or resist it actually makes it worse. And it can perpetuate the idea that our anxiety is intolerable, that it will never end. But accepting our anxiety also doesn't mean liking it or resigning ourselves to a miserable existence. That's not what I'm talking about here. It just means that we would benefit by accepting the reality in the moment as it is. You know, and as it turns out, reality includes anxiety in this particular moment. So the bottom line is that the feeling of anxiety is less than ideal. There's no question about that. But it's not intolerable. And like all feelings, all thoughts, and so on, it will pass at some point. So especially if we get to that place of acceptance and then employ some of these other things here, along with HeartMath, as we'll see. So we'll go into, excuse me, a bit of an introduction now. Excuse me, I'm just going to have a sip of water. So an introduction to the HeartMath solution. HeartMath, one of the key things to know here about HeartMath is that aside from having a kind of a strange name, HeartMath, I know it struck me that way when I first heard it, but aside from the odd name, one of the key features, of course, is that it's completely an evidence-based system that includes certain techniques that we can use, and also technologies, which I'll touch on later in the presentation here. And for managing stress, but also for improving health and our overall performance, moving, in fact, to a place of optimal performance, which we will see as we go along. Also, just so you know, at the end here, I will be doing a quick review of one of the techniques, and give you a chance to practice that. We'll do that for a few minutes, and you'll be able to learn one of the HeartMath techniques that you can take away with you and apply it immediately in stressful situations. So as we said, there's been all kinds of, not just research, but published research, studies that have been published in peer-reviewed medical journals and other publications. And of course, HeartMath themselves, they have been around for about, I think it's 25 years or so, and for the last 20 especially, they've been doing all kinds of studies, dozens of studies, on the effectiveness and the power of HeartMath as a solution for reducing stress and anxiety, but other health benefits as well, as we'll see. The bottom line with all of these studies and their whole approach really is the physiology of what the HeartMath folks call coherence. and also optimal functioning. So what we're looking at here is the connection between the heart and the brain, and then of course the brain with the body, because as we know, the brain is sending messages to the body continually through the automatic kinds of functions of the body, the heartbeat and the working of the lungs and so on and so forth, all of the organs. And what they've discovered, of course, is that the heart is sending messages to the brain, not just the brain to the heart. And this connection between heart, brain, and the rest of the body, and then also as well the impact of thoughts and emotions all tie into this overall sense of coherence. And what they mean by coherence is really just bringing balance to all of these aspects that we just mentioned. So both the tools and the techniques of HeartMath help us to create coherence. Excuse me. So a state of coherence, or sorry, a state of synchronization between heart, brain, nervous system, and emotions. And this measurable physiological state is the foundation of optimal performance and health. So as we see in this diagram here with the rowers, they're all in synchronization, they're all rowing at the same time. And when we get that kind of a thing, and for anybody that's seen that on TV, you can see how smoothly the boat moves along and how in sync and harmonized really the rowers look when they're all in sync like that. And what this does, of course, is coherence creates a calm and lucid, energized kind of state. And this is how it's a little bit different than simply relaxation, a relaxation response, as we touched on earlier, because we can get into a coherent state even in the middle of activity because it energizes us. It both relaxes us and energizes us, which is an interesting kind of combination. So it can be used at times when we have to be active, when we're going into a meeting or we're going into some kind of activity where we have to be really calm, or we want to be calm and lucid, but also energized at the same time. So some of the studies that show that coherence significantly improves health and well-being. As you can see, lots of studies done here. These are just a few of the ones that have been done. But coherence through the HeartMath Solution basically increases our ability to self-regulate. And what we're talking about here is really that ability to bring our emotions into a regulated kind of place where we're not being overwhelmed by our emotional world, we're not being overwhelmed by the stresses and the anxieties that we're experiencing, that we're in fact getting to a place of calmness and well-being, increased calmness and well-being, increased emotional stability. We're improving the hormonal balance. The main stress hormone, which is cortisol, comes down. And DHEA, which is what we call the happy hormone, increases. So we're bringing a quite important balance back to the hormonal system, in that, of course, by bringing that balance, we're reducing anxiety and stress and increasing our ability to focus. And another side benefit, of course, is the ability to manage pain. Has also been covered in some of the studies. So this may look like a little bit of a confusing slide here, but it's actually, if we look at it, and I'll explain it to you, because this is an important concept with HeartMath. It's called heart rate variability, HRV. And what this is measuring, and this is an important measure, as we'll see as we go along here. So in the first one, what it's measuring here is the beat-to-beat rhythm of the heart. Beat-to-beat rhythm of the heart. So from this peak to this peak, we can see that it's 0.859 seconds. And what that comes out to is if this was to repeat over and over again, it would come out to 70 beats per minute. This one is a little bit lower, so that would come out to 76 beats per minute. And lower again would be 83 beats per minute. So what the heart rate variability is doing is it's taking these three measures and then leveling them out into one number, which is your heart rate variability, how it's varying from beat to beat, the beat-to-beat measure. And we'll see how that's important as we go along here. Oops, sorry about that. So, heart rate variability indicators. In other words, why is this important? Why are we looking at this? So we have the most HRV, or the highest heart rate variability when we are young, and it steadily declines as we age. And this is for all of us, by the way. It's not just for certain individuals. Our heart rate variability is much, much higher when we're younger, and it just slowly, gradually decreases as we age. But the important thing here is that it's the below normal heart rate variability for our particular age that's a strong indicator or predictor for future health problems, including all-cause mortality. And this is the result of many studies done even outside of the HeartMath organization, in medical journals and so on, that are looking at heart rate variability and the importance of it. Heart rate variability is also an important indicator of psychological resilience, the ability to handle stress. So the more we get into the heart rate variability range of our particular age, and we get a nice smooth sine wave, which we'll see in a few minutes here, that's an indicator of our ability to be resilient, psychologically and emotionally resilient, and to handle stressors and anxiety in our life. And we can get to this place through the practice of the HeartMath techniques and also using the technology too. And using them both together actually is even better results. So higher levels of heart rate variability are associated with superior mental performance as well on tasks requiring executive function. So this could be things like tests and so on, important tests that people might be involved in. So here we have the graph, which I've used in some other presentations, but of course this is from the HeartMath folks, and it's looking at coherence and incoherence, and the importance of the emotions and the heart rhythms together. So as we can see here, we can see just by looking at this visual that this is kind of a jagged, uneven, and what we would call imbalanced kind of heart rate variability graph. And what this is showing is what HeartMath folks call incoherence. So this incoherent kind of graph here, result, we know is impairing our performance and increasing our energy drain. It's basically inhibiting the brain function, what they call incoherence. Coherence, on the other hand, as you can see, we get a nice smooth sine wave-like graph here that's promoting optimal performance and also building our resiliency, our emotional and psychological resilience. So it's facilitating brain function. And this is a typical kind of comparison here, because when people first get on these heart monitors that HeartMath provides, you'll see something like this, or similar. It'll be a little bit different for each of us. But then the goal, of course, is through using the techniques and the monitors, we can see how we're improving as we go along. When we're getting into this kind of a place here on a regular, consistent kind of basis, then we're definitely feeling the results of doing those exercises. So the other important thing to know here is the relationship between the heart and the brain. And the way that we look at the heart, of course, has changed due to research, especially over the last couple of decades. And what they found is that the heart, just like the ancients said, that the heart has its own mind, the heart mind. Well, this has been proven now in scientific studies that the heart has its own complex nervous system called the heart brain. And as we touched on earlier, the heart sends far more information to the brain than the brain sends to the heart. And this was a surprise, a kind of a surprise finding in various studies. This, of course, was not known up until probably a couple decades ago, and then the knowledge has increased from that point as well, and the importance of this. So the heart signals especially affect the brain centers involved in strategic thinking, reaction times, and self-regulation. So what we're seeing is that when we're in that incoherent state, it's affecting our thinking. We're not able to think strategically, not able to make clean decisions and decisions that are effective and so on. Our reaction times are slowed, and our self-regulation is hindered or reduced. So very important aspect to know. And the heart rhythms, of course, directly affect physical and mental performance, as we said. And the brain centers involved in emotional perception, decision-making, reaction times, social awareness, and the ability to self-regulate. These are all very important. So we can see again the two graphs prepared on the one chart here, the incoherence and the coherence. And the importance of what I'd like to point out here is, without getting into all the science of this, that the heart is often, what it's doing is picking up signals from around us, something that we would say is like a trigger for anxiety or stress. The heart brain is actually picking it up before the thinking brain does. And when the heart brain picks that up, sends a message up to the amygdala, where emotional memory resides. And what the amygdala is doing is it's doing a pattern match. It's comparing what we're seeing out here in the world with things that we have in our emotional memory. So if we had a bad experience of some sort, think typically of a soldier that's come back from battle. Veterans that come back and they're experiencing PTSD and so on, and they hear a loud bang of a car backfiring or something. Actually, the heart brain picks that up, sends the message to the amygdala. The amygdala sends a message down through the medulla and through the body, through the autonomic nervous system, and all of a sudden we're in that fight or flight response before the thinking brain can even react, and that's the important thing here. But the key, and the reason I'm bringing this up to you is, of course, not as a science lesson, but that this automatic response, this automatic reaction, and instantaneous reaction, as we touched on earlier, can actually be intervened. We can intervene here and stop this kind of automatic reaction just through the exercise of these techniques and so on. So we're looking at the improvements in brain functions, such as the ability to self-regulate, as we touched on, but 40% improvement in long-term memory, 24% improvement in short-term memory, ability to focus, process information, reaction times, and so on. Just some more studies that we. So the HeartMath heart rate variability monitors, and that's the technology that I spoke to earlier. What we're doing is we're learning to shift into a coherent state, and that is greatly facilitated by user-friendly and fun technology, the M-Wave, what they call the M-Wave, and the inner balance heart rhythm monitors. So, and it is actually fun technology, and we'll see as we go along here a little bit. But by using the monitors, we can develop self-awareness very quickly, along with the skill of self-management or self-regulating our emotional response. And we can, in turn, reduce stress and anxiety and the symptoms of anxiety. So, as we said earlier, we know that there is a profound link now, because of all the research that's been done between emotions, stress, and coherence. Emotions underpin the influence health, cognitive performance, and overall well-being. And I would add to that the sense of, or the feeling of well-being. This is what I've noted in using these techniques and tools, and also with my clients. And I've worked with clients, many clients that are experiencing anxiety and stress, and to the point where it's getting overwhelming and prohibitive in terms of just living their life and so on, in what we would call a quote-unquote average or normal way. And so just by using these techniques and technology, we get to a place of that managing of the emotions, the self-regulating, and also just an overall feeling of well-being. Stress reduction is key to improving health and well-being. And that's just kind of a almost an intuitive sense that most of us would realize, really. But as we said earlier, relaxation alone is not enough. It does help, but it's not enough. So this is just a quick picture of the technologies here. The M-Wave Pro, it's called, works on desktop computers, or laptops. And as you can see here, you can see the incoherent and then the coherent kind of sine wave. And also, this is the one that I use when I'm working with clients, and most health professionals use this application, but lay people can buy this as well if you prefer to have one on your desktop. And there's all kinds of tools and things that go along with this application, like games that are fun. Children love these games, by the way, so you can use this with your children as well. And adults do too. I enjoy them. It's like you kind of challenge yourself in a way. And what you're doing is, here's a better example of it. When we look at the inner balance, and this is the application that I recommend to my clients most often, because it works on smartphones like the iPhone, other smartphones, also tablets and iPad, iPod, and so on. And it's really a simple device that connects to the port there, and then you have a sensor that just simply clips onto your earlobe. And that's going to measure your heartbeat, but also your heart rate variability, which is the really important measure that we're looking for in terms of reducing the anxiety and stress in our life. So the M-Wave technology and the inner balance, I would say, facilitate the process of shifting into a coherent state. So as we saw earlier, we want to get into that coherent state. And by using the technology along with the techniques, of which I'll share one of them with you soon, helps to facilitate, to get us into that coherent state, in a state of emotional regulation and kind of optimal performance. So it measures and, of course, encourages that coherence building. And with practice, progressively increases the ability to shift to the coherent state on our own. So we use the technology, we use the techniques, and then over time it becomes second nature, just like anything that we practice. And we can apply this throughout our day and in all different areas of our life too. So the M-Wave technology, or the inner balance as well, improve physical, mental, emotional balance, intuitive decision making, increases our energy levels, improves mental acuity, problem solving skills, quickly stabilize and maintain balance in stress-charged situations, and prepares and us to be coherent before engaging in potentially stressful situations, such as going into meetings or a difficult phone call that you might have to make, or a presentation like this presentation today. I did HeartMath before I started, and I always do. So it does help tremendously with that. Competition, there's even lots of athletes that are using the HeartMath now as well to increase their optimal performance and so on. And all of these points that you see on this slide, of course, are all backed up by the various researches that have been done that we touched on earlier, and others, of course. So as we can see, there's all kinds of people that are using HeartMath technology now. I won't bother reading all these, you can see them, but one of the ones I wanted to mention here was the police agencies. It's not just the police agencies now, but other first responders like firefighters. Also, HeartMath has an amazing program that they've developed with the Veterans Administration's hospitals around the U.S. to assist the veterans coming back from, of course, these combat zones in places like Afghanistan and Iraq and so on. And the levels of PTSD post-traumatic stress disorder have increased to the highest levels that they've ever seen from veterans coming back from conflict zones around the world. So these veterans are being helped through the cooperation between the HeartMath organization and the Veterans Administration's hospitals in a huge way. Also of interest to some of you may be, especially with your children, it's been highly effective with ADD and ADHD. And they work with many clinics around the U.S. I'm not sure about Canada, but I know that the technology does work in regards to this. There's more information that can be found on their website. Sorry, and I'll give you that website a little bit later. Also, drug and alcohol treatment, and I have used this with several of my clients dealing with drug and alcohol addictions, and to great effect too. They find it very powerful and very helpful, because often with addiction kinds of issues too, we have anxiety and depression and so on that go along with that, and the HeartMath solution is very helpful for those things. So what I'd like to do now is to spend a few minutes and teach you the what's called the quick coherence technique, and this is one of the kind of flagship techniques of the HeartMath solution. And what I get you to do, for those of you that are comfortable, just close your eyes for a few minutes and sit comfortably in your chair there. And you can do this with eyes open as well, but I usually recommend to people that you start with eyes closed, especially the first few times, till you get kind of into the rhythm of doing this. And after you do get into the rhythm and it starts to become second nature, you can do it with your eyes open. You can do it even as you're active and out and about in the world, doing various things at work or in other settings as well. So you just sit comfortably, close your eyes, just relax as best you can. So what I'd like you to do now is to focus your attention in the area of the heart. I find that this really helps. I get my clients in my practice to do this, is to just place your hand over your heart, your right hand, place it over the center of your chest. It helps to bring your focus there to the heart area. I find it very helpful myself. So imagine your breath is flowing in and out of your heart or chest area. Breathe a little bit slower and a little deeper than you usually do. But just imagine that air going in and out directly of the heart space there. And if you can, this is a suggestion, if you can, inhale for 5 seconds and exhale for 5 seconds. So you just count to yourself, to count of 5, breathing in and out. If 5 seems a bit too much for you, you can just do 2 or 3, that's fine. Whatever's comfortable for you. So just continue to do that for a minute or so. Imagining the air going in and out. To count of 5 on the in-breath and the out-breath. Keeping your focus on the heart center. Now if your mind wanders, just very gently bring it back. Very gently bring it back to the focus on the heart and counting the breath in and out. Going in and out of the heart space. Now, as best you can, carry on with what you're doing, but at the same time, make a sincere attempt to experience a positive feeling, such as appreciation, or gratitude, or care for someone or something in your life. So picture, you can picture the person in your mind's eye, if that helps. So what we're trying to do here, really, what's really the key here is to re-experience the actual feeling of gratitude, the actual feeling of, if gratitude is hard for you to bring up, it can be something like a love for somebody that you have, or a special pet, a special place even, an accomplishment in your life. So just try to re-experience that for a moment while you're doing the breathing, focused on your heart space. If you find this difficult, then you can try focusing on just a feeling or a sense of ease or calm as well. That works just as well. Okay, so I think we have a sense of it now of what this can be like, and I hope that was a good experience for you. What I suggest to my clients, and I suggest to you, is that if you would like to experience this and try it in your life, is to do it for 5 minutes, at least a couple times a day, as a kind of a regular practice. So, kind of first thing in the morning or before you start your day. Just go to a quiet place where you won't be disturbed, and all it takes is about 5 minutes. And then sometime during the day when you get the chance, maybe at lunch or coffee break, whatever, go to a quiet place and do this. And also, you can use it before you go into a meeting that you know might be quite stressful, or a particular phone call or a person that you have to meet with that you know is going to produce some anxiety. You can do this quick coherence technique before that meeting, before that phone call. And what I suggest to people is to do it after as well. So do it before and then do it after. And also that regular kind of practice of twice a day is going to go a long way to helping you to move towards that coherent state, and to make that really the norm for you over time. Okay, so just a reminder of some of the things that HeartMath helps with. We've touched mostly on stress and anxiety, but it also helps physical issues as well, like cardiac problems, pain management, addictions and recovery, which we touched on. Cancer, it's been very effective. Not so much with the illness itself, although that has shown some results, but it's more to do with the anxiety and the stress and sometimes depression that people, as we might suspect, experience when they receive a serious diagnosis like that. But it can be very, very helpful for that, for cancer patients, along with some of the other things that we've mentioned that help reduce stress and anxiety. And of course, some of the other things that we've seen here, ADD, ADHD, trauma, and PTSD, and so on. Yeah, so we will be sending you, I'll be sending you a brochure as well through Lamar at Humanicare. He'll be sending this out to all of the participants. And this will just give you a little more information about HeartMath and so on for those of you that are interested. And if for those of you that would like to do a little more digging and research, you can go to the HeartMath site, heartmath.org, and there are free articles and videos, techniques that are there for you. And you can also go to, if you're interested in looking at purchasing one of these books or other books that they have and so on, or the technology as well, like the Inner Balance, to help you with to do these techniques and so on, you can go to heartmath.com. So what I'd like to do at this time is, if there's any questions at all. If anybody has any questions, please feel free to push on the click on the question button in your control panel there, and feel free to type in a question, and I will do my best to answer it. Okay, so I have, let's see here. Best way to introduce to children age 8. Well, the best way to, thank you for that question. I think that's Lisa that asked that question. The best way to introduce to children, especially age 8, is there's all kinds of resources on the HeartMath.org website that I just pointed out. Free articles, and also specifically there are several free techniques and how we would do those techniques with children, especially in different age groups. And so you just look on the website and dig around, and you will find these techniques that are specifically geared for children, because they're more like they're designed like a game. And most children just love these games. They get right into the spirit of it, and they love being challenged and so on, because it's a fun game for them, but it's also very effective. It helps them to deal with their own anxiety and stress levels. So highly recommend it for children as well. So I guess that's the best way to answer the question, is to go to the website, and you can find the free resources there. Also, what I would add to that is, of course, the inner balance. If you decide to purchase an inner balance tool and application there for your smartphone or whatever, then you can have your children use that as well. That's another tool for you to use that way. Okay, so let's see, I think we have another question here. Yeah. So the question is, if we want to purchase an M-Wave 2, is there a way to get a discount on the product, as it is covered by health plan benefits? Oh, is it covered by health plan benefits? Whether it's covered or not by the health plan benefits, I can't really answer that. You would have to ask someone at HumanCare. So I can't say whether it is or not. So best to get a hold of HumanCare themselves. And let me see here. Yeah, so you can go to info@humancare.com, or you can call them at the 1-800 number, and they can help you out with that. I would not recommend the M-Wave 2, even though it showed on the diagram. The best application is really for lay people is the Inner Balance, it's called. And the Inner Balance, of course, works on smartphones, iPads, and other tablets, and so on. So I hope that answered your question. Okay, we have another question here. Any idea if these tools are covered by work benefit plans? So another question of the same nature, so I hope I answered that for you as well there. Just please get a hold of HumanCare, and they'll be able to help you. One person saying, thank you, Lori. Thank you, Lori. Thank you for listening today. I think that's it. I think I've covered the questions here. Let me just go through one more time. If anybody else has a question, please feel free to type it in there now. Yeah, I guess that was it for that. So, okay, great. So, again, my name is Brian Haley. It's been a pleasure to present on HeartMath to you today. If you have any further questions, like some people do have, about whether benefits cover this or not, please get a hold of HumanCare, and they'll be able to help you out in that regard. Thank you very much for listening today, and bye for now.